Great. Okay. Hi, everyone. I think we have, should we wait? Is it 10? It's 10:03, so we can get started. Hi, everyone. Good morning. We just wanted to introduce Dr. Nelli Gluzman. We're so excited to have you back. You were here with us back in December, so we so appreciate you coming back and doing more educational webinars with us. For those who are new to Enriched Parenting, our nonprofit is really just with the intention and the mission to spread education and awareness. Sorry, I have a bit of a cold, so I'm a little bit like congested right now. But really, our mission is just to spread education, awareness on health, well-being, and really to put the power back to the people, taking control of their health and their family's health and well-being. So it just starts really with education and feeling informed and empowered. And I always say, like, the oftentimes what we see is people making decisions from a place of fear, not necessarily knowledge. And that's where things really start to fall apart. So we want to really, our mission is to just give the education and the information so that people feel empowered and feel confident in their decisions, and not making decisions from that place of fear, but that place of power and feeling good. So that's really the essence of what we're about. You can follow us, on Facebook, on Instagram. You can sign up to receive our monthly newsletters, and our webinars we're really excited about. We started this past year. So again, we're excited to get started. We have Dr. Nelli Gluzman. She has a pediatric practice, holistic pediatric practice in Manhattan. So everyone who wants to contact her, Blossom Pediatrics is the name of her practice. And I'm going to let you tell more about yourself, and I'm going to silence myself, and then I'm going to let you kind of take over. Okay.
Thank you. Yeah, thank you so much for having me back on. I love Enriched Parenting. I am myself an enriched parent, and I started my path of being a holistic pediatrician and switching over from conventional pediatrics to this kind of practice because of one of the reasons was because I started following Enriched Parenting. So coming back here again in this capacity means so much to me because it changed the trajectory of my life, the life of my patients so much. My family, everybody's healthier, happier, more well-informed. And so it means so much to me for you to have me on as a presenter. And the topic that we're going to talk about today is one of my favorite topics because I think that it's not something that's very commonly discussed in medicine. As a conventionally trained pediatrician working in a hospital setting for 10 years, all through med school and residency, no one has really ever spoken about the importance of detox and how the body gets rid of toxins and how important this is and how to support that naturally in a holistic way, in a safe way. And so I'm here to talk to you today about how to detox your child in a safe, holistic, gentle way and the importance of that. And so, well, the reason why I choose to talk about this at this time of year specifically, and it's always important, but specifically this time of year is we're in the winter season. And so as you can probably see, there are so many colds. The flu is going around in a big way right now. The days are shorter, meaning less time outside and less sun exposure, less vitamin D production. The heat is usually very dry in the home. The air outside is very dry. And so we're also post-holiday season. And so I feel like there's a lot more sugar in the diet now than maybe also in the past month or so. And so supporting detox, especially this time of year, can make a big difference in how the body fights infections, which are always around us, and how good we feel, even though the days are shorter and it's cold and it's dark. And so the ways that the body detoxes, there's so many different ways. Primarily, we talk about the liver, the kidneys, the digestive system, and the skin as the major detoxification organs in the body. Other detoxification pathways include the lungs and the lymphatic system. So I'll go over each one and how we can support detox in each of these body systems in a really safe, gentle, holistic way. So we can detox through the kidneys are one of the major ways we detox. Urine contains excess fluid in the body and also waste. That's how we get rid of a lot of the waste. So when I can't stress this enough. It seems so obvious, but it makes a really big difference. When we drink only water or fruit infused water instead of juices or any kinds of sodas or any kinds of anything with basically with sugar in it, we can definitely increase our metabolic rate, which aids in detox, also aids in digestive health, and dramatically supports the immune system. So I would say this is probably the easiest way to help our kids detox and ourselves. Like if, let's say, a child is used to drinking different kinds of beverages that are not water throughout the day, just doing like a water detox, basically just drinking water for a whole week, you will notice a big difference in the energy levels, the way that kids are stooling, how they're able to fight infections, their brain power, mood. I found this to be a really, really strong and easy thing to do. And one of the most common questions that I get asked is how much water is enough water for both adults and children. And so the rule of thumb is we take the child's weight in pounds and we divide that in half, and that's how many ounces they should be drinking daily. But on hot, sweaty, active days, if they're participating in sports, for example, or well, not so hot and sweaty now in the Northeast, but if you're on vacation, I would say definitely add more water to that. There's really other holistic providers say that once you're thirsty, it's already a little bit too late. Thirst is already like a late symptom of not having enough water in the system. So if you're going to choose anything to help the body detox and help your child detox all the toxins in the body, I would say start with this. This is the major platform on which everything rests, just drinking water. My favorite infusions of water are to add, let's say, orange, lemon, lime, and infuse that overnight, or lemon, orange, strawberry, cucumber, lime. Older kids usually like that one, or strawberry sage is a really interesting combination of water infusions. And so whatever fruit you have laying around, the riper the better, you could just throw it into the water and then drink it throughout the day, and it's almost a replacement for sugary drinks. um, in I found that a lot of kids who are used to drinking juice, um, they don't like to drink water because it's kind of a much blander taste. And so a trick that I use and I recommend to parents is to water down the juice with water a little bit every day for about a week. So the kids acclimate to the taste of just drinking water and not something so sugary and so sweet. Now, we could also detox through our digestive system, meaning one of the major, most important ways we get rid of toxins in our bodies is by stooling. So let's say your child is not going regularly or tends to get constipated. This is more than just a discomfort or a problem. This is actually the body not getting rid of waste properly. And so anything that supports our digestive system and our ability to stool is hugely important for detox. Some things that I like to recommend to my patients is to yeah.
So thank you for saying that you have selected to join in a different browser device.
Oh, that might be you, because I tried to.
Oh, I can hear you. Hold on. I lost my slides for a second. I'm gonna try to get them back.
Yeah, that was me. That was me. I was trying to join. I might have to just join
Okay.
it myself. Here.
Okay. Yeah, I'm uploading it back on.
Yeah, you're fine.
So
It's
I
still going. You can see
I'll
over
look
here. Just
back in.
just join. I was gonna join it myself.
Okay. So can you hear me? Yes. Okay. So stooling, so important. Some of the tricks that I use to get leafy greens into the body, which really help in digestion and stooling, is to add leafy greens. And so kids notoriously don't usually like to eat leafy greens like a salad, but I love throwing a handful of leafy greens into like a smoothie in the morning. It's almost impossible to taste. If you throw kale or spinach or any leafy green, that helps with a real fiber content and that helps stooling. And doing that in the morning will really help wake up the digestive system and allow for regular stooling to occur. So water that we just spoke about also helps tremendously in helping stooling. Kids who are dehydrated, they don't stool as well and as often. So there we go. Now, there are some issues that are very specific to some kids and adults, such as leaky gut. And so whenever there's a problem with digestion in general, whether it's having a lot of diarrhea, loose stools, abdominal pain, that means that the gut detoxification pathway isn't functioning at its prime, and that's really, really important to treat and take care of. It's vital. I also noticed that a lot of times, maybe not so important this time of year, but when younger kids, they start school for the first time, like preschool or kindergarten, when they're going, or maybe even daycare for the first time, I noticed this really big spike in constipation because kids are afraid to go in, and maybe they're not paying attention. And so if you have a child that's starting school for the first time, it helps tremendously to like sit down with them and explain how important it is to go regularly. Working in a hospital setting, there's a huge rise in severe constipation, hospital admissions, when kids are about like 4, 5, 6 years old, because they're kind of tend to sometimes choose to keep playing instead of listening to their body and using and going to stool. And so I find it really, really important to like have these conversations with kids around this age. It does make a big difference. Now, the microbiome topic, this is the cornerstone of all health, in my opinion, when the microbiome is thriving and healthy and diverse and rich with the right kinds of viruses, bacteria, yeasts. When it's healthy, this could really not just support all of the body's proper functions, but also helps detoxify chemicals, heavy metals, BPAs, and pesticides. And those things are increasingly found around us more and more. Now, foods that can support gut detoxification include anything that supports the healthy microbiome. So, what is this? Probiotic foods, including sauerkraut and kimchi. Sauerkraut is my favorite. Sauerkraut is fermented cabbage. This is my favorite. If you're in the Northeast, I find it to be my favorite fermented food because, one, it's easiest to make, and two, because it grows here locally. And so anything that is local and locally grown organically, doesn't have to be transported across many, many miles and different countries. Those are the best foods to be eating. Those are the healthiest. And so when you're fermenting something, always choose things that are locally grown, if possible, and organic. Now, probiotics, we've probably all heard about. It's very popular. There's also prebiotics, which are actually food for our microbiome. This is what the gut bacteria like to eat, and that includes Jerusalem artichoke, garlic, and onions. Water helps support the microbiome, as well as physical activity and dietary fiber, leafy greens, for example. But I am very, very much against supplementing with supplements that are fiber, because it's a chemical, it's made in a lab, it's not real. And so the microbiome doesn't really benefit from that as the fake fiber that you could get from like a packet or a chewable. There's nothing that replaces real food for fiber. Magnesium is also found in leafy greens, and this is really important to support the microbiome. And freshly ground flax seeds are so good for not only supporting the microbiome, but help eliminate toxic byproducts with stooling because they have something called ligands. Ligands are broken down by our healthy gut microbiome, which help bind and eliminate toxins. Flax seeds, they have to be ground up, so sometimes they're sold as whole seeds, but it's best to grind it up maybe in like a coffee grinder, any kind of, even in a blender, grind it up, because this is the only way to really be able to digest flax seeds. Now, cooking with garlic and onions are not, those things are not only anti-inflammatory, but make food taste delicious and are potent prebiotics. Now, supporting the liver is immensely important. The liver is the main detox organ. And so the main chemical that the liver uses is called glutathione. This is one of our liver's most important detoxifier and antioxidant in the body. Where do you get glutathione? Well, things like vegetables like arugula, bok choy, kale, broccoli, cauliflower, Brussels sprouts, collard greens, cabbage, radish, and turnips. They contain things called glucosinolates, which break down into isothiocyanates, which are precursors to glutathione. Glutathione is what helps the liver detox everything we detox. Other things that help glutathione production and the liver detox is intermittent fasting. Now, intermittent fasting is something that is usually spoken about in for adults, and I don't recommend intermittent fasting specifically for children. But if you don't eat right before bed, and let's say you stop eating a few hours before bed, and let's say a child's bedtime is between let's say 8 or 9 p.m., and you stop eating at 6 p.m., not only do you allow the digestive system to rest, but you also actually inadvertently creating intermittent fasting, because a long time period occurs between the last meal and the morning meal. And so that helps support phase 2 liver detoxification. Other things that are really helpful for the liver are olive oil, which contain phenols, and berries, which are also have antioxidants. Both olive oil and different kinds of berries increase glutathione production. Now, sleeping more helps really. High quality sleep flushes out the toxins in the brain, and kids and adults are very much affected by exposure to blue light. What is blue light? Blue light comes from any kind of artificial light, screens, TVs, phones. What that does, and there's more and more research coming out about this, and you might notice more and more conversations happening in the holistic communities about how much the blue light exposure prevents proper sleep. So even though sleep will still happen, the quality of sleep is severely impacted by blue light exposure close to bedtime. As a rule of thumb, I would say aim at shutting off media, screens, lots of artificial lights at least 3 hours before bedtime for the best possible sleep for both you and your children. And it really also helps to have your child go to sleep at the same time every night. And so that kind of high quality sleep helps protect our brain and to detoxify the brain. Sun exposure is extremely important. There's a lot of controversy about sun exposure. There was a time where a lot of the medical community was saying sun is terrible, sun is bad, it will cause cancer. But the truth is that we do all need a certain amount of healthy sun exposure. The healthiest sun exposure time is during non-peak sun hours, which are before 11 a.m. and after 4 p.m. And so this is a very limited window in the Northeast right now because the sun sets so early. But spending like 10 to 20 minutes outdoors every day in the sun without sunscreen before 11 a.m. or after 4 p.m., at least 10 to 20 minutes, not only eliminates a very silent toxin in the form of stress, but helps produce vitamin D, which is a key component in not only detoxification, but most of the body's major functions. Sweating is really interesting. So sweating is a really important detoxification pathway in the body that only works when it's turned on. And what that means is if you're not sweating on a regular basis, you are not getting the benefits of this type of detoxification pathway. So saunas are very popular for adults. And I don't recommend necessarily using saunas for children, really depending on the age, maybe older children, yes, for a little bit. But getting really wonderful physical exercise, running around, produces the same kind of sweating that you would get from a sauna. And so physical activity, cardiovascular activity, running around, maybe joining I just had my child join a running club and she comes back super sweaty. And so I think that helps, especially during the winter, turn on that detoxification pathway. Something else that kind of was very popular and then it kind of fell out of popularity, but I think is very important to mention, is dry brushing. Dry brushing with a brush on the skin actually works through stimulating the lymphatic system and helps remove toxins on the surface of the skin. The skin is the biggest organ that we have, and exfoliating dead skin helps that detoxification pathway as well. Now, there's two ways to support detoxification. What we spoke about just now was adding things in, but even more important, I think, is removing chemicals in our environment. That could look like a lot of different things. At the very least, I would say refer to something called the clean and dirty dozen when choosing the kinds of organic foods to buy. So some foods that usually have like a really thick skin around it, not so important to buy organic. And it might not always be available. The price cost, you always have to consider how much something costs as well. But in referring to the environmental working group, Clean 15, the cleanest kinds of produce, and the dirty dozen, meaning the things that you should really always be buying organic, is very important. Then there's household cleaners. I tend to clean everything vinegar. It dries. When it dries, it doesn't smell like vinegar. It kills everything. It's safe. It's healthy. It doesn't have harmful chemicals. I really suggest considering the kinds of chemical cleaners that are in your home. And with that thought in mind, also consider what are you putting on your body? Are you using soaps, lotions, detergents that have a lot of nasty chemicals that end up seeping in through the skin and into the system? I also highly recommend avoiding unnecessary medications. Now, your medication that eats up glutathione severely is Tylenol. And so sometimes it's important to use Tylenol, but sometimes it's not absolutely necessary. Just be cognizant that when you're using Tylenol or acetaminophen, same thing, you're taking up all of the glutathione, the major detoxification chemical in the body. And so if there's a cold and there's a fever and Tylenol is taken, it's going to take that much longer to replenish glutathione. And that's something to really consider before using antipyretics like acetaminophen. Now, it wouldn't be a conversation about detox without talking about something called MTHFR, which stands for methylene tetrahydrofolate reductase. MTHFR is encoded by the MTHFR gene, which you might have heard of. This is an enzyme that works as a catalyst for important biochemical reactions in the body. And one of the main things that MTHFR does is converts vitamin B9 or folate into methyl, which is essential for a process called methylation. Every single cell in the body and every tissue in the body experiences methylation as a detoxification pathway. Methylation protects your body by repairing damaged cells and optimizing DNA cell function. It also processes toxins and hormones, and metabolizes B vitamins and regulates neurotransmitters. It's a really important chemical process. It turns homocysteine into methionine, and methionine builds proteins, repairs cells, detoxifies, supports inflammatory response, and helps the liver process fats. Most importantly, methionine produces glutathione, which is what we talked about as the major detoxification pathway of the liver. It's the body's most potent detoxifier. So what is an MTHFR mutation? About 30% of Americans have one polymorphism or kind of a mutation in MTHFR. 10% have two polymorphisms. And the MTHFR SNP is basically the mutation, is common. About 50% of the US population carries at least one SNP. Now, two MT genes commonly studied of massive importance are called C67A1298C. And each of these genes, you could have no polymorphism, which is called wild type, one polymorphism, which is called heterozygous, or two, which is a homozygous mutation. The more mutations you have, the less MTHFR enzyme is able to do its job effectively. When your ability to methylate is decreased, there is a greater potential for the mutation to impact health. So if you have one change in either of the genes, it's referred to as a heterozygous state of the SNP. But two changes is a homozygous state of the SNP. So one or even two changes in the A1298C usually doesn't lead to any health consequences or medical issues, but it does merit some awareness. While changes in the C677T can, with two changes presenting the greatest likelihood of potential risk for medical problems. So sometimes it's worth being tested to see if there is a mutation of the MTHFR gene. Conventional testing is for the MTHFR SNPs themselves. You could also test for homocysteine, B12, and folate levels to see if there's a risk. In my practice at Blossom Pediatrics, I check for the MTHFR SNPs themselves, along with testing for the homocysteine B12 for certain populations of children. So if a child has a sibling or parent with MTHFR-related birth defects or behavioral changes or autism, I test. Any child with symptoms or a family medical history that could be attributed to an MTHFR SNP, and the list is long, like depression, heart disease, stroke, children born with neural tube defects, Hashimoto's thyroiditis, hypothyroidism, blood clots, infertility, cardiovascular disease, family history of Alzheimer's, depression, birth defects, certain cancers. I test those children for the MTHFR mutation. And I also test children with behavioral challenges or on the autistic spectrum. I do these tests because if there is a mutation of the MTHFR SNP or gene, it's certain changes could be made to protect the child. And this is especially important when talking about vaccines. And so there are certain things that could be done to protect the child from exposures or helping detoxify. And having this information, it's easy to obtain, it's not very expensive, and it can make a world of difference for future development, detoxification. And so a lot of conventional pediatricians don't do this kind of testing yet. But again, with certain family history or even anyone that just wants to know, I do test for this at Blossom Pediatrics so that you could, as a parent, make better, more well-informed decisions. Regardless of our MTHFR status, we all need to be mindful of supporting our child's elimination and detoxification pathways, which means avoiding toxin exposures within our control, in our diets, in the household, body products, leading to more healthful, mindful lives. So should you get tested, what can be done? Vaccines do have a lot of toxicity associated with them. And so most of the children that I work with, I do put them on a homeopathic regimen to help detox. it would start about 1 day prior to 2 weeks after, and it would have a homeopathic variety of things like thuja, ledum, silicea, unda, HMF powder. Depending on what vaccine is given, each child with different risk factors and different vaccines, if there is vaccination happening, I would definitely recommend helping the body detox through homeopathic safe remedies. And then this is one of my favorite things to recommend that makes a big difference is post-vaccine detox baths. Not just post-vaccine, but really for daily use. I love the baths because they're safe, they're effective. Um, there's really no downside to them. So I highly recommend Epsom salt baths because they contain magnesium. It relaxes the body's muscles. Magnesium is something that a lot of people in the Northeast in America are really deficient in. And so Epsom salt helps draw out a lot of toxins and impurities in the body, helps replenish magnesium, helps the nervous system. And so that is extremely helpful. Adding baking soda to a bath is really interesting because it helps combat the pH problem with chlorine added to the water supply in New York, for example. I also recommend getting a really good filter for the shower. The one that I got, which I think is really amazing, is called Berkey, and I have maybe you've heard of it. It's pretty popular, but Berkey makes a shower filter, and the water that comes out from a Berkey shower filter is you could drink it basically. It's amazing. The difference is huge. Bentonite clay baths are also very helpful because it literally draws out the toxins out of the body. Apple cider vinegar is a remedy that I use for so many different things. Adding it to a bath helps with kids who have eczema tremendously. It also helps combat yeast. And some kids who are not able to tolerate Epsom salt baths, they benefit from Dead Sea salt, which is a little bit more gentle. So it doesn't have as much magnesium, but it does create a lot of detoxification. And so doing these baths, not just post-vaccine, but always, it's something that I try to incorporate into my child's life, maybe on a weekly basis. And it's especially easy for babies because they're getting baths anyway. Why not add that to the one or many of these different holistic modalities into the bath? And then thank you. I really appreciate your time. If you have any questions, I can answer them now.
Dr. Gluzman, thank you so much. Let me ask you, there's a lot of people who discuss detox, and even when we had, were sharing the webinar, there was a lot of concern. Well, why would you need to detox the body? It naturally detoxifies and it's dangerous or it's invasive. And I mean, from the things that you just went through, they just seem very subtle and non-invasive. But what are your thoughts about when people, I'm sure you probably heard the same thing.
Yeah, so there are a lot of different supplements in the world of functional medicine that help detoxify heavy metals, for example. It might work, but doing a heavy metal detox using a supplement to draw out all the heavy metals in the body, it could become dangerous. And so it might be helpful for maybe an adult, but it causes a lot of side effects. So I feel like with children, you have to be really, really gentle because when you're drawing out heavy metals from the body using chelation, something that maybe that's what you're referring to, chelating heavy metals, all that stuff comes out of the organs and into the bloodstream at the same time. And so you kind of create toxicity while you're detoxing. And I don't think that's really very gentle for most children, or very safe. There are just so many products out there. I'm very skeptical of a lot of them, actually, because I've seen a lot of kids have a lot of very serious side effects and regression. A lot of parents who have children who have developmental delays and they start a really heavy metal detox, the symptoms that are very, very specific for the kids, they get a lot worse. And so there's just a lot more gentle way to do it. Supporting the body's natural detox process is safer and gentler, and so you don't have to go through this really heavy duty chelation process to get the same effects. A little bit longer, but I feel like supporting the body over it, you just create you won't have to do this heavy duty stuff. There's ways to test for heavy metals. Hair, blood is another one. Urine, you can test for heavy metal exposure. But I found in my practice that doing a very gentle detox using baths is just as effective, although it may take a little bit longer than doing chelation in the forms of like supplements that cause a lot more side effects.
Got it. Okay. So there are some questions I'm seeing. You're able to see them, right? On the right-hand side?
Oh yeah, now you see them.
So I think the first one was from Gabriella Mong. She asked, should we not just buy pre-ground flax?
It's a great question. So when I was doing this research for flax, every book, everyone says like grind up your flax. I'm like, why can't we just buy pre-ground flax? I don't have an answer for you. I feel like
so can I so from my knowledge, I'll just throw my 2 cents if that's okay.
Yeah.
From my understanding, once it's ground, it becomes more it actually, what is the word? Becomes more rancid. Like it loses a lot of its, so freshly ground. So what I did for my kids, or I would buy the little, it's really inexpensive. You can buy the little coffee grinder. You know what I'm talking about? It's a little mini coffee grinder. And I would throw in like half a cup every time I would make them oatmeal in the morning, and I would just throw in the freshly ground flax. But from my understanding, it would lose, it becomes rancid more quickly, and it loses like the, I guess, certain beneficial like nutrients by buying the pre-ground.
I think it's oxidized. Yeah, exposure to oxygen. So I would keep it in a really tight container once you grind it up. And do you keep it in the fridge too, Rebecca?
Yeah, but see, I would just do every morning. It was so easy. I haven't made them actually oatmeal in a while, but in the winter I find it clogged. I mean, I do eggs a lot more, but that's besides the point. I just would, it's like $10 and you just buy it. So I would literally just do it every morning. It takes 1 second. And then I would just throw it in with the oatmeal. So I don't know if that helps, but can you hear me? Sorry, am I losing you?
Yeah.
Oh, now we hear you. Okay.
There's a question about cradle cap.
Yeah. Hannah asked, any advice for cradle cap?
So cradle cap is really like a normal, it's not a pathological state, but it could be very irritating to a child, and it could hurt when it's severe enough. And so one gentle way to deal with it is to use olive oil to kind of massage it off, or maybe coconut oil, virgin coconut oil. And I find it very helpful to also use apple cider vinegar, not strong, but diluted, like a apple cider vinegar bath, putting it on the scalp.
Yeah, I mean, I think it's true. I mean, I would do it the olive oil, and you just use also like those soft baby brushes, you know, the little, and then it would loosen it, and it would just kind of come off on its own at times, over time. Okay, so the next one, Chaya asked, how much Epsom salt should be added to a bath for a child?
So it depends on the size of the bath. So, baby bath is a lot smaller than a whole bathtub. I would say I add a half a cup to a whole bathtub. For a baby bath, I would add a couple of tablespoons. There's really no way to do too much, though. The body takes what it needs, and then it stops taking. You can't really overdo magnesium in a bath.
Let me ask you, when you were saying, you mentioned the different things that you put in the bath, baking soda, the Epsom salt. So is that something that you would recommend putting together at once, or you would kind of stagger different things at different times?
You could put it all together. I sometimes do. Yeah. You know what I don't put in the bath? I wouldn't put essential oils actually, unless they're in a carrier, because the essential oils, even though they smell great and they're very wonderful, unless they're in a carrier that like an olive oil or coconut oil carrier oil, it's not going to mix with the bath, and that could be really irritating on the skin of a young child or an older child. So a lot of like detox baths, if you look up recipes online for great healing, soothing baths, they would add essential oils to it, but because they're not mixing, they'll just sit on top of skin, and that could be really irritating and not necessarily healthy.
Right. Okay. So I don't. So you see where we're holding with the questions. You see, Gitzel
Yeah.
asked about a homemade dishwasher
Homemade
gel.
dishwasher gel or liquid.
Maybe we could like try to figure that one out.
So I don't have a homemade dishwasher gel. That's a hard one. But what I can say is that there's two things that I find to be possibly very uh, good for the dishwasher. One of them is, so you can't use it on like metal spoons and forks and cutlery, but you can use it on ceramic. It's citric acid, like citric acid powder. That's very safe, gentle, and it really dissolves everything. And I also use vinegar in the dishwasher pretty often, and it's actually very good for a dishwasher because it cleans out all the impurities, so the dishwasher works better. And then
You see, Josefa asked.
there's a question. Can you be more specific about what homeopathic remedies to give before vaccines? So every single different kind of vaccine has a different kind of protocol that I use in my practice. So it really depends on what's in the vaccine being given. And how many are being given. And so the homeopathic remedies that I mentioned is kind of like the major homeopathic remedies that I use for kids getting vaccines in general, but homeopathy is very specific to each patient and the concerns. And so it's just so personalized that it's hard to say like specifically exactly which one it is. I tend to use it longer for multiple vaccines, like up to 2 weeks every day. When multiple vaccines are given, if a child has reacted poorly in the past, I do it even longer, the combination. So because it's so specific, it's not one size fits all at all.
Yeah, I imagine also it's so dependent on
Homeopathy.
each
So
child and their history and what their, everything, their makeup is. And like, so I think that's like a really, I mean, that would be a really difficult thing to answer.
yeah. So you know what? Homeopathy is so wonderful and so effective and so safe and gentle. I would say if you're interested, like work with somebody that knows homeopathy really well, whether it's a holistic pediatrician or a homeopath. And there's so many out there. It is worth going to one, especially when you're talking about vaccine detox.
Right, for sure.
And then there's a question about advanced TRS. So advanced TRS it uses nanotechnology to remove and cleanse toxins from heavy metals. I wouldn't use them for younger kids, like 'cause it kind of is a chelator. It could really draw out. It can work, and it could draw out a lot of heavy metals from organs and into the bloodstream. But that's really only reserved for very specific cases where the benefit of doing this outweighs the risk. I would never just recommend going to get it online and get it yourself. I would work with a practitioner that knows chelation really, really well, because there are, even though you might not say it online, you could just get it buy it online and do it, and it could work. Kids who have this problem, who usually need it, are at high risk for having these heavy metals in their system. And so regression can occur. And so I would be very, very careful using things like advanced TRS or any other chelators to detoxify a person. I wouldn't do it without working with a practitioner that knows this really well. And there's certain other things that need to be done to support the process of elimination. So even though advanced TRS can draw out a lot of the impurities and heavy metals from organs, getting rid of it from the body is another step that's usually very often neglected. And so this is why I think it's really important to work with somebody that knows these things really well, like a functional medicine provider or integrative medicine provider. Those fields know how to use them properly and whether the benefit outweighs the risk. Yeah.
Okay. You see Gabriella asked another question. You see that question? Where to buy?
Oh, where to buy Dead Sea salt? Okay, so I get mine from Israel. I get mine. Somebody brings it to me from. It's like a small shop in Israel. If I can post it on my, I can post. I don't have it on me. The brand. It's in Hebrew. So I can't really say where it's gotten. Somebody brings it to me, but I can post a picture of it. Maybe later on, like I don't know, under the link for this webinar recording. The best glutathione supplement. Glutathione is interesting because there's a problem with there's kind of a problem with its taste. They all taste disgusting, and so if you can't get a kid to take it, like younger kids who are not able to swallow capsules, they'll need it as a powder. The one that I use is by Pure Encapsulations. So, but the powders, thing that can be done about it, they're all disgusting. And so it's just really sometimes very hard to have a child take it. But the one that I like is Pure Encapsulations. What if your child drinks a lot of water but still doesn't sweat much and only passes stool after water, like very athletic, exercises daily? So everybody's norm is different. It's completely normal for some kids to have multiple stools a day. For other kids, they'll stool once a day, and there's some kids that stool once every other day. So everybody's normal is different. Just because your child doesn't stool like multiple times a day or every day doesn't mean that they're constipated. Looking at the kind of stool that is being produced is very helpful. So if it's like pebbles or little hard rocks, or it looks like I don't know, bird droppings, that's constipation. If there's belly pain all the time before stooling, that's constipation. If they're sitting on the toilet for a long time, that's constipation. If your child drinks a lot of water and doesn't sweat much, everybody is different. That's completely okay. That's just them. I wouldn't be worried about it as long as you know that your child is getting a lot of water. So, and then there's a question about, is it beneficial to combine baking soda and Epsom salt for a detox bath? Yes, I combine both. What about combining apple cider vinegar and baking soda? Do they cancel each other out because of acid base, or do they work well together? I would say they work well together. They work well together. Apple cider vinegar does not cancel out the baking soda. I think it makes it, in my opinion, a little bit more gentle to use, because apple cider vinegar is a bit more acidic, and that's not the healing property of it, the acidity. So I put them together in the same bath. Another question: how can we help kids with constant ear infections? That's a great question. Ear infections are one of the most common infections in children. Why children and not adults? Because the eustachian tube, the tube that goes from the ear to the inside of the mouth is very horizontal in children compared to when a little bit more vertical, and so the ear doesn't drain as well. So helping kids with constant ear infections, it really depends on the cause of the ear infections. There are certain modalities like that I find to be very helpful, massaging certain ways inside the mouth, kind of to expel the contents of the eustachian tube helps a lot. I think it also really helps to strengthen the immune system using herbs and supplements and sleep, so that when there's exposure to a cold, um, they're not necessarily going to be a bacterial infection. Most ear infections, by the way, are viral. So a lot of times kids get put on antibiotics and then more antibiotics and more antibiotics, and that kind of creates this loop of the body needing antibiotics every single time. And so I would try to avoid that if it's not absolutely necessary. There are very specific guidelines in antibiotic use. Antibiotics are overused in ear infections. The whole entire American Academy of Pediatrics is constantly trying to readjust on when it's really appropriate to use antibiotics for ear infections. And so I would just be really, really cognizant of, does your child really need antibiotics for the ear infections because of that loop that can happen. I also find it very helpful in the winter season to make sure that the air is uh, moist. And what that means is using a humidifier if it's really dry in the room, if there's really dry forced heat, using non-toxic nasal saline because the ears and the nose are connected. So having a severe congestion or very dry nasal passages can lead to ear infections. So there's saline that can be used in the nose, like before bed. Now they sell a lot of stuff in the pharmacy, like little remedies or little noses, and if you little remedy is nasal spray. If you look at the back of the bottle, you'll see that there are a lot of chemicals in that one. I don't recommend using any chemicals for children. There is a brand that I love called X Clear, which makes nasal spray, which doesn't have any chemicals. And so whenever you're buying something to kind of air and moisturize nasal passages, I would be really careful about what you're getting, what you're buying, because it could be even more irritating to use these chemical ones.
Dr. Leslie, what do you think
I think my baby. Yeah.
What do you think
Neti
about
pot.
the
Okay.
neti pot? Because I think
So
like if it's foreign to a kid, it's kind of scary and rolling. But if they become accustomed to it, I find that it's just like anything else, learning to brush your teeth. It's also, but I don't know what your thoughts are on the neti pot.
there's a bit of controversy in the medical community about the neti pot. So there are some practitioners that believe that using a neti pot, which is basically saline irrigating the nasal passages deeply, using like it looks like a little pot, and base irrigating with water, and usually it's a saline that's used. So a few things about the neti pot. There are some practitioners that believe that if there's an infection, it's going to draw the infection deeper into the sinuses, into the nasal passages. So I'm a little, I don't necessarily use it when there's a severe bacterial sinus infection. Physically, you can really draw, you want it to come out, but you at the same time, you could have all that mucus with bacteria go a little bit deeper. Now, neti pot is very helpful, in my opinion, for things like exposures for seasonal allergies. There are a lot of studies saying that if you irrigate and clean out the nose using a neti pot or something similar, you're gonna have a lot less allergy symptoms, like at night, if you do it, once every night. So that's like a good reason to do it. But when there's a severe bacterial infection in the sinuses, I would be very careful of doing that. Now,
Like preventative, like one
yeah,
thing.
yeah, exactly.
When we talk about ear infections, for ear infections in general, I mean, from my end, like it happens to be none of my kids have ever had ear infections, so I'm not And I never used the neti pot for an ear infection, but I was thinking more like preventatively. Or I also, my question is it not a way of detox? Is that not a way of the body naturally detoxifying itself when it's coming out of the nose, coming out of the ears? Is it typical that when you see a kid who has chronic or regular ear infections, recurrent ear infections, is it a possible sign that the kid is, in a way, the body's working effectively, that it's actually ridding itself of things that need to come out? Or is that not something you would
Yeah.
consider?
So preventatively, yes, use it. If there's a full-blown bacterial infection, I would be careful. I wouldn't really use it. You might get a lot of different opinions on it from different providers. I would also be really aware of what you're putting in the neti pot, because the actual brand, like neti pot brand, has this powder mix that has a lot of harsh chemicals in it. And so I would just make my own like salt
Yeah,
solution,
yeah. I
like
never just
using
thought.
yeah, like if it has a lot of preservatives. What they recommend using, it's a neti pot kit, and it comes with its own packets, but the packets have a lot of preservatives and chemicals, and that's
I
not
never saw
necessarily
the pack.
healthy.
I bought my neti pot. So it was handmade by a woman.
Oh, okay, that's
And
amazing.
yeah, and I don't know, I never even knew that they came with packets, but you just make it with the water and your own salt. And
Yes, and my one of my favorite salts to use has a lot of natural and that would be a Celtic salt is like one of my favorites to use in neti pot. Yeah.
okay.
Um, so there's another
Okay,
question. I think my baby has silent reflux. What helps that? So, okay, so silent reflux. There are a couple of things that are extremely helpful that you might or might not already know about, but I find it kind of like a lost art. Silent reflux. It really depends on what causes it. It depends on how old the child is. But there are certain things in a newborn and maybe under 12 months old that is extremely helpful, makes a huge difference. So those things are elevating the head of the bassinet, or basically having the baby sleep at about 30 or 45-degree angle. So if the baby's sleeping in a bassinet, you take a like a hand towel and you put it under the mattress of the bassinet, not under the baby, but under like the mattress if you can, creating a wedge so that gravity keeps everything down in the stomach. That's very, very helpful. That's very, very helpful. We use this in the hospital. So that's like number one. Like before you start any medications, which are, in my opinion, very dangerous sometimes. Acid blockers are very dangerous sometimes, and sometimes you need them, but very often these conservative measures are not in place, and so a lot of times kids are being put on these acid blockers that without doing all the other things that you could do to help support the body and to help keep all the food in the stomach and not going up into the esophagus through the lower esophageal sphincter. So elevating the head about 30-45 degrees above the stomach. Another way to combat this is keeping the baby upright for much, much longer than you typically would, allowing the air to come out as a burp if needed. That helps a lot of kids combat silent reflux as well. Now, if it's an older child and they're have already different kinds of foods that are being introduced into their diet, there are certain things that could be done to prevent silent reflux. Something that a lot of kids respond really well to, not babies, but older children over one, is having a little bit of apple cider vinegar especially in the morning, diluted. So how does that work with reflux? Not all reflux caused by the same reason, but a lot of reflux is caused by the fact that there's not enough acidity to support digestion. So when there's not enough acidity in the stomach to support digestion, the stomach churns even harder to try to digest the food. When the stomach is churning really hard to digest the food, some of the contents of the stomach goes through the lower esophageal sphincter and into the esophagus, causing reflux symptoms. When you add a little bit of acidity to help support digestion in the form of very safe diluted apple cider vinegar, even a teaspoon diluted in water, that helps, especially in the morning, helps not only wake up the digestive system, but helps support the acidity to help the stomach churn and digest the food. And so it doesn't have to work so hard, churn so hard, and the contents don't shoot up into the esophagus. That is that is everything. That was like a life changer for me. Personally, this is not something that a lot of people know about, but it is extremely effective and very safe to do. Yeah.
So Chaya was just
the next question. Thank you for the December webinar. I used quite a few times the cabbage for fever. My kids like it, and it felt refreshing and calming and cooling. Thank you. You're very welcome. Anything that is safe and gentle and effective goes on my to-do list. So thank you for the thank you. Any suggestions for detergent? Okay, so I'm a busy mom. I work a lot, so I don't have time to make my own products all the time. I'm not that handy, but whenever I purchase anything for the home, like detergents, and if it's not vinegar that I'm using, I always refer to the environmental working group to look at the rating for toxicity. The environmental working group has a database of all, and it's free. It's a database of all the common products that are sold, and it lists every single ingredient in each product, and it basically gives it a rating, and it tells you exactly what it can cause. And so that helps me make well kind of products to get. So the detergent that I'm using now is called Good Planet, I think it's called, but you can just refer to that environmental working group database to see if the things that are in your household or things that you're about to buy, what kind of rating and grading is given for the chemicals that are being used in that product.
There's a great app. I'm just going to mention it because it actually bases it off of EWG. It's called Think Dirty. Have you heard of that app?
Yeah, it's great. Yeah.
It's a great app. So you can download it and you can scan like different products while you're in the store, and it will tell you its ratings. And I'll tell you the most shocking one to me was the what is it called? The one that, oh, you know what? I just lost my thought. But there's a very common one that people use, and it looks very, the labeling looks very organic and very natural, but it's like a 4 rating, which is really pretty toxic, and you would want to stay away from it. I'm going to think of it in a second. I'll mention it to you, but it's a great app. It's very convenient, and you can test any product. If you're shopping, you can just, literally scan it. It will pop up and it will tell you what the rating is. So that might be helpful to some. And I'm going to think of that one that I think I've seen so many people use it and they just don't know. But okay, then I think there's another question about strep. Did you see that one?
No, can you read it?
The best way to treat strep. Did you see that question?
No, I didn't. What can you read it to me again? What is the best way to combat strep?
Okay, 1 second. We did skip back to my forehead was itchy all over. Okay, so we'll talk about detergents. What's the amount of ACV and baking soda put in the detox bath? I think you said like half a cup, right, of each one.
Yeah, so if it's a giant bathtub, I would say like apple cider vinegar, I put in about a half a cup, and Epsom salt, I put in about a half a cup. That's a lot. That's for a whole full size bathtub. But if you're using like a baby bathtub, I would do like a few tablespoons. Okay, and then there was a question about my child is itchy all over. My
better detergent.
Itchy all over, and I want to switch to a better detergent. Any ideas what I can do? Refer to the environmental working group. And I would really consider trying to use apple cider vinegar. The itchiness all over, it could be contact dermatitis, like something in a detergent that is being used, but it could also be from the inside. And so there's so many different reasons why kids are itchy all over. It's not normal. It could be a symptom of something. So um, uh, if it's eczema or kind of an early eczema, apple cider vinegar baths are amazing. Is colloid silver a good alternative to antibiotics? So it's kind of there are not enough studies using best practice guidelines and double-blind placebo studies out there for colloid silver. It doesn't mean it doesn't work, but when somebody does really need to be on antibiotics for serious bacterial infection, I would say you need them antibiotics. But colloid silver is also antiviral, and so because that, so if it's like a mild infection or an adjunct to a bacterial infection, I would recommend using colloid silver as not as an alternative to antibiotics, but as an adjunct to kind of help kill bacteria. Again, most illnesses, it's interesting because most ear infections, most pneumonia even, most sinus infections, they're all viral. And so colloid silver is a great way to try to support the immune system in getting rid of those viral infections. What is the best way to treat strep? So when a child is over a certain age, I would say like 4 years old, strep does need to be taken seriously not because of the actual infection, but because of the repercussions it may have as the child gets older. And so, so if a child is like under 3 years old, strep doesn't necessarily need to be treated with antibiotics because the repercussions for having strep at that age, you don't build autoimmunity to it. And so it's not always necessary to treat strep in very young children. And that is something that your pediatrician pediatrics, not just holistic pediatrics, but all pediatrics. And so if your child is very young and is diagnosed with strep, really maybe ask your pediatrician, is it really necessary to treat with antibiotics in this age? Any recommendations for a good air purifier? My best recommendation for air purification is to sleep with the window cracked open. That's number one. Even in the wintertime, I think it's fresh air. It helps circulate the air. The air doesn't get as stagnant. It helps with preventing viral infections. Kids sleep better. If that's not always possible, even cracked a little bit. But if that's not always possible, there's a really good air purifier called Molecule, which is a little bit expensive, but for kids who have pretty bad allergies to like dust, I find it to be very helpful, at least for my patients. So it's called Molecule with a K. That's a really good, that uses the most advanced technology that I was able to find recently.
Can we just go back to the colloidal silver for 1 second? From my understanding, colloidal silver, though, also it works this in the way that it works similar to antibiotics. So it kills the good and the bad bacteria, correct? Or is that not something?
Can you repeat that, please?
That colloidal silver works in the same way that antibiotics work, where it will kill both good and bad bacteria. So we want to use it very sparingly, just as we would antibiotics.
Yes, and that is correct. That's a great point. And whenever you're using antibiotics or colloid silver, you also afterwards have to do a really thorough replenishment of the microbiome, which is found not just the gut, but on the skin, in the mucous membranes. And so that is something that's kind of lost as an art. Replenishing the good bacteria after an illness or after a colloid silver course or after an antibiotic course is something that needs to be always addressed and thought about. Just because the infection is gone doesn't mean that your health is back. And restoring the microbiome diversity is so, so important. Using a wide variety of modalities, like using fermented foods, maybe going on a really thorough probiotic protocol as well.
Right, absolutely. And then also
Yes.
for the air purifier, when you mentioned opening the window, I know a lot of times people in the winter, they want to use humidifiers. And my understanding, humidifiers also put back a lot of mold into the air. So if they open the window, I've heard, you can put little bit of a little pot of water next to the window, and that will naturally put the moisture back into the air without having a humidifier where you are potentially putting a lot of mold and other things that you don't necessarily want, especially if you have kids with allergies or sensitivities.
Um, having a humidifier running is like having, I feel like it's like having a dog or a pet, because you have to babysit it constantly. You cannot leave water sitting in it for even for a few hours without it running. So let's say you run out of water in a humidifier, and then there's just a little bit of water left. It's going to grow mold very quickly, and that could be dangerous. It's going to grow mold very quickly. And so unless you're really dedicated to taking care of your humidifier, cleaning it out periodically, making sure that there's no water sitting in it ever, like if you're going for a few days or a weekend, you just can't let any water sit in it and for any period of time, because mold will grow so quickly because it's warm and wet. So I love the recommendation of putting just even like wet towels around the room also helps. It's like an older version of a humidifier, keeping the air moist. I mean, if you want to try it, like you'll see that using a pot of water next to the window, or putting like moist towels near the bed, will produce the same kind of humidity as a humidifier.
Okay,
Yeah.
that's great. Oh, Khani asks, when it comes back, she's back to the ear infections. When the eardrum ruptures, do you need antibiotics?
Not necessarily. It depends on why the eardrum ruptured. Most eardrums, when there's a rupture to the eardrum, it should heal by itself without necessarily needing any antibiotics. The antibiotics are used preventatively. It's not absolutely necessary. It depends on how severe it is, and it depends on why it ruptured. If it ruptured because of a bacterial infection and there's pus there, and that's determined by looking at it, then you might need maybe antibiotic drops, not necessarily oral antibiotics. So it really depends on why it ruptured. And was it ruptured because of a viral infection or bacterial? Is there pus now? The eardrum should be able to heal by itself fully if it ruptured, without needing any antibiotics. But determining that, it will only take a skilled practitioner to take a look and see what the risks and benefits of using the antibiotics are. Like if it's a really severe bacterial infection and there's pus draining out, or if it ruptured because of something called a otitis externa, which is an outer ear infection instead of an inner ear infection, different antibiotics can be used, whether it's drops or oral, if they need to be used. And Liz said, I found a chiropractor to be hugely helpful for baby reflux. If you could recommend, if I'm always looking for amazing chiropractors in the area to refer to. So if you could send me a message about who you use, that would be great, because I'm always looking to refer to chiropractors out. Sometimes what is needed is a physical readjustment to the system, and there are not that many chiropractors that work with babies. And so it's, Liz, if you could write who you use, that would be really great. Gabriella wrote, favorite brands for probiotics for children that don't break the bank. So I did an experiment there are so many probiotics out on the market, and some of them have amazing like, they look really good, they have really nice packaging, They're sold in Whole Foods, for example. They seem really great. So what I did was actually, and I do this periodically still, is take all the common brands of probiotics, ones that many of my patients use, and also the ones that I recommend, and do an experiment and take milk, put all the different probiotics in it, like a science experiment, and see what grows. And you would be so surprised to see how ineffective most probiotics are. Sometimes one brand could have different batches where one batch will be very effective and will create yogurt when I put it, and another batch will be very ineffective and nothing will happen. Probiotics are alive. They need to be stored a certain way. Very often they don't make it to you properly. Sometimes they just die. And so the probiotic that I found to be most consistently useful, helpful, and always ranks high in my experiments is called Clear Labs. It's with a Klaire Labs probiotics. They make them for babies as drops and also chewables for young kids. And whenever I do these experiments a few times a year, Clear Labs is consistently creating excellent yogurt, meaning it's very, very much alive. Their practices are excellent. This is kind of the probiotic that most functional medicine practitioners kind of like recommend for each other, and it's not that expensive. About a month's supply is about 30 something dollars, so it doesn't break the bank fully. And they have different kinds of formulations depending on what the problem is. They also created a probiotic that I find to be very good for older kids, which works specifically with the types of bacteria for the mind gut connection, the probiotics. And so whenever I use that probiotic, that formulation, I kind of use that for kids who are like about to take their SATs or studying a lot. And so that helps also with brain health.
Can I also I just want to mention with regards to probiotics, as you had said, that the importance of how it's stored and kept. So there is a company that it's called the Professional Supplement Center. Mm-hmm. And what is good about them is you can, first of all, you can be on their reoccurring shipments. So they give you, and if you do that, you get like 10% off every order. I've been using them for years. They're excellent. They're out of Florida. They have great customer service. And they always come shipped properly. They come in the ice. It's always, it's always cold. It's because that's a big thing. I think people can order on Amazon, but not necessarily do we know if it's been stored properly or kept in the right, temperatures during shipment or during storage. And they also have a really nice service where they have I think it's a holistic nurse that they have consults if you're trying to figure out which probiotic to use or which vitamin or whatever supplement you're ordering. So it's just a great company that I always recommend to people because I think they guarantee, proper storage of probiotics. And especially when it comes to probiotics, like you said, it's just so important how it's been stored and how it's shipped. But Clear Labs, I agree. Right. Clear Labs is the best. It's a great company.
Yeah. Thank you. Ariella asked a question. My 8-month-old keeps getting ear infections. Any recommendations? I already use garlic oil, but that doesn't really help. So prevention, I think, is so super important for infections in general. I would support the immune system in a big way. So what does that mean? Well, number 1, sleep. Number 2, sunshine. Number 3, certain herbs that I find to be extremely helpful in boosting the immune system. It's everything. So some of the herbs that I use is I'm sure you've heard, elderberry syrup, making sure that it doesn't have a lot of chemicals, that it's by somebody that uses best practices, that uses real natural elderberries when they're making it. So elderberry syrup is a big one. Also, I tend to also like, I feel like uh, certain medicinal mushroom formulations like um, astragalus and ashwagandha, they help boost the immune system, especially for ear infections. Now, the brand that I buy everything from is a small, tiny brand. It's the person that grows all of these things and makes it herself is Susanna Raven. She has a farm upstate New York. She makes everything herself. Everything is organic. It's real. It's a small company. It's incredible. And so that's where I get most of the herbs. And I actually have a guide on my website for all. I created a guide because like what does a holistic pediatrician have in her medicine cabinet to fight infections, to treat infections, to boost the immune system. So if you go to my website, blossompediatrics.com, I created like an ebook with all the different things that I love to use to boost the.
Oh, you're back. I was just like just going to share this with people while you were busy. But the Think Dirty app. So Mrs. Meyer's, which is such a common brand, and I made a mistake. It's 1 out of 10, not 1 out of 5. But I don't know if you can even see from the phone. It's such a common brand that people, it gives the impression. Let me see if I can show it to you. From the branding that it looks so natural and so healthy, and it's just. But really, what you see is that they carry all 8s. Almost not on everything, but on a lot of their products, it rates as an 8. So I just think that that's, the point of really looking at what you're buying. So even if it says, all natural, it can be so deceiving. And so that's why I love this app. It just helps, like, gets right to the point. You don't have to do much other than scan the product. But I'm happy you're back. So I'm going to let you go back to what we were doing. I think we were talking about the 8-month-old. I just had mentioned maybe also diet, like maybe what something the baby's eating or is sensitive to. The dairy, I don't know what, obviously we don't know what this 8-month-old is breastfeeding or is nursing or is bottle feeding but also like even maybe some of the solids. I assume probably at 8 months, a lot of people have already introduced solids. So maybe some of the foods.
A lot of kids are sensitive to dairy. There's a way to test for milk protein allergy. I'm not saying dairy is all bad, but everybody responds differently to it. So at 8 months, you usually don't have, I mean, it's not like, you don't have milk, but if the baby's being breastfed and the mom is drinking dairy milk, that could be something that causes a lot of mucus production in a lot of kids, and that can cause a lot of the extra mucus can cause an increased risk for ear infections. I found to be true.
Okay. I don't know where we left off. Okay, so Liz was going to send you the chiropractor.
Thank you, Liz.
8-month-old. Thank you so much for this. Okay. We're so happy you guys joined us. Oh, Shira asked, how would you treat pandas?
That's a really pandas is a new diagnosis in the healthcare community, and there is a lot of controversy on whether or not with a lot of conventional pediatricians, not everybody and neurologists, not everybody's on board with pandas as a diagnosis. I am, and I treat it, and sometimes antibiotics are necessary for pandas, supporting detoxification. There are also a lot of different modalities that I don't perform that are a little bit more harsh, that things like hyperbaric oxygen chambers and intravenous immunoglobulins. Those are different modalities that a lot of different centers perform, but those are very invasive, and so I don't do those. I more tend to support detoxification, use a natural holistic approach, use homeopathy, and sometimes antibiotics when it's necessary to treat pandas. Catching it early is really important. PANS also. And so if you have a child who suddenly has a change in temperament or neurological status, or just doesn't seem right to you, is having symptoms, finding a practitioner that really listens to you as a parent about the change that you might have noticed is really, really important, because it's a time-sensitive diagnosis and treatment. Yeah.
Okay, and then I think I know we're kind of short on time here. Do you have another minute, Dr. Gluzman? Or
Yeah,
she
I
has
do.
how over 4 years. So over 4 should they be treated with a 4-year-old should be treated with antibiotics for strep. I think he's asking, if they're over 4, should they be treated with antibiotics?
I would say yes, it's important to do that, but the kinds of antibiotics, it doesn't have to be like such a heavy duty one, and also that a lot of practitioners treat for a very long period of time, like 10 days. That's a lot. That really does a lot of damage to the good bacteria in the body and the microbiome. And so, um, yes, technically, strep is important to treat. I also see a question about chronic strep. A lot of people are carriers of strep. That doesn't necessarily mean that they need to be treated. Sometimes, when you're a carrier of strep, it's not causing any symptoms, but you can spread it. And so there's a lot of controversy about whether or not that carrier state always needs to be treated or not. If it's not causing any symptoms and it just happens to be that a swab is done and there is positive for strep, that doesn't necessarily mean that it's going to cause any issues later on in life or needs to be treated. Yeah. There's a question from Yael. Why do newborns hiccup a lot? I get that question a lot. So a hiccup is the diaphragm basically spasming. I can't say why newborns hiccup a lot, but I can say that it's completely benign, meaning it's not dangerous. It's not associated with any medical problems or issues later on in life or digestion. Um, so older kids, I would say drink a little bit more water, but if it's a newborn hiccuping a lot, I don't think there's much you can do except maybe making sure that you're burping the baby pretty well.
Okay. Liz said she has some chiropractors in Oregon. What's the name of the planter? You mentioned a planter. Do you see that question by Ariella?
Planter.
I don't know what that's
I'm
about.
not sure which planter you're referring to and then my 8-month-old that you were talking about is drinking Happy Baby organic formula, and it's solids like organic oatmeal, sweet potato, zucchini, spinach, no dairy, occasionally yogurt. All of his food is organic, including lots of fresh fruit. I make all his food, nothing is pre-made. How do you feel about doing tubes for ear infections? So when a child gets repeat ear infections, tubes help prevent ear infections by allowing the the middle ear to constantly drain. It's kind of creating like the same thing that a eustachian tube does into the inside of the mouth. It does it to the outside. So I feel like if there's constantly ear infections, those are the kids that qualify for ear tubes. I think that, if it's needing to be done, that it needs to be done, and I feel like it's very helpful. The ear tubes can eventually fall out, and that's quite all right. I don't feel like it causes a lot of problems later on in life. It doesn't really affect hearing. So as a preventative for kids who have chronic ear infections, I think it's worthwhile going to an ear, nose, and throat doctor to see if they qualify for ear tubes. Great question by Robert. Pandas' diagnosis has been around since 1998. Why is it still controversial among pediatrics? Because there's no billable insurance code. So there's that. I love that question. I am just as frustrated as you are. um, the pediatric community is behind in things very often by, I don't know, 20 years sometimes. There's no billable insurance code because it's not considered a diagnosis. And so unless it's just all conventional pediatrics is behind because they need to do a lot of testing and double-blind placebo studies, and then policies have to be made, and so there's a lot of bureaucracy, and it's unfortunate because modern current science, things that we know about true health, the importance of the microbiome, that's only gonna come out in conventional pediatrics in about 20 years. And this is why I tend to have deviated from that field quite a bit, and really using a combination of traditional wisdom, but also things that make most sense. So I know pandas is a diagnosis. It's treatable. I don't know why it's such a delay. It's unfortunate because a lot of kids are not getting the help they need. But I would say, as a parent, if you feel like something's off with your child, and you go to your pediatrician and they tell you no, everything is okay. This is not a real diagnosis. I would say find another pediatrician, because as a parent, you do know your child best. So that's my advice to you. Which is the small company that you buy immune boosters from? Um, my favorite company is called Raven Crest Botanicals. I can write it down in the messenger. Yeah. So, I mean, here, Raven Crest Botan, and I mean, this is the best because the person that owns the company, it's a small company. She grows everything herself. I think they sing over the plants. Everything is done so beautifully, with lots of love given to the plants and the herbs. I would just be a little bit weary about, for smaller kids. A lot of the products have alcohol in it to preserve it, but you can reach out to the owner, Susanna Raven, and ask her to make formulations specifically for your young child that doesn't have any alcohol in it, like the elderberry syrup, for example. So it won't last as long, but since you're using these things frequently for preventative things, I would say it's definitely worth it, and it's not that expensive, um and it's supporting small farmers, and so that's my favorite company.
And let me ask you for like the question about the she mentioned Ariel had mentioned about the food. Do you think it would be wise to look at the diet, or you would look at, is there a way where they could do a food sensitivity or an elimination diet, maybe add foods that are easily digestible, easy to process, like broths, warm foods? I don't know, what are your thoughts
Yeah,
about
in
that?
my practice, I use food as the most primary basic way to heal, a person, heal the child, boost the immune system. So it's very, very specific. It's really important to make sure that, like, let's say the problem is sensitivities to different foods, not only just eliminating is helpful, but restoring the gut flora so that you don't need to have an elimination later on in the future. So a lot of times I do like a detox for children who are frequently sick, with like just doing stocks for like a day, and then adding very easy to digest, simple uh, proteins, healthy fats, a lot of animal fats when necessary, making sure everything is like the vegetables are cooked because they're easy to digest, while to restore the gut flora. I feel like most of the health comes from a healthy microbiome, and using food to heal the microbiome and heal the gut lining is baseline everything. So a lot of kids that I work with, when that's in order, they stop getting sick. They're able to fight off infections. They stop getting strep. And so, yeah. So,
Do you recommend, like here, Judith just mentioned here, thanks so much for the information about, you didn't mention vitamin C. Um, do you
mhm.
recommend in general like a certain vitamin daily protocol, like let's say a regular vitamin D for children, omegas? What is your thoughts about like a regular?
Yeah. So there's vitamin C is great, but um, it is kind of like made in a lab and manufactured in a certain way. And I would say it's even more important to have foods that are very rich in vitamin C, like, for example, kiwi or citrus, if that's available during that time of year. Something that is really very helpful is cod liver oil when it's fermented. I use that for a lot of my patients as a fish oil, and only certain brands vitamin D supplementation is really important. The most easy to absorb vitamin A and vitamin D comes from cod liver oil, and this is kind of like a lost thing, and I found it to be one of the most baseline important things to use every day, although it doesn't taste very good. Fermented cod liver oil is a big one. I do use high doses of vitamin C, especially in older children when they're about to get sick. There's the evidence on it is kind of mixed. I use it for myself. Like if I feel like I'm about to get sick, I use buffer vitamin C to kind of ward off the infections. Yeah. Is echinacea safe for an 8-month-old? So yeah, it is safe for an 8-month-old, but make sure that the echinacea is not is titrated for that size. A lot of times the dosage that is provided is not for an 8-month-old child, and so it needs to be the company that you're using is giving you dosages for that age. And also making sure that there's no alcohol in it. A brand that makes a really safe supplement with echinacea for under 12 months old is Herb Farm. It's farm is spelled Pharm. No, yeah, Herb Herb Pharm. Do you recommend Garden of Life vitamins for kids? I don't use that brand personally. Most of the time, I don't recommend the multivitamin because the kids that I work with are on a very strict, very specific, actual dietary plan, and so you can't really replace real food for vitamins. So we also, Rebecca mentioned fish oil. I am a big fan of fish oil. I use it for kids. Nordic Naturals is the brand that I like to use, and a lot of my co-practitioners use as well. It's a pretty reliable brand.
Give a good multivite. Okay, so I think we're done, and I really appreciate you spending so much time with us today and answering everyone's questions.
You're very welcome. Thank you so much. This was so much fun, and it was so nice to connect with the viewers and listeners, and I really appreciate your time too.
Thank you, Dr. Gluzman. And we so anyone who wants to reach out to Dr. Gluzman, she's on Instagram. You're also on Facebook. You have your website is, what is your website? Blossom Pediatrics.
Yeah, blossomPediatrics.com.
Okay.
I'll write it down right now.
Okay, awesome. And in our monthly newsletter, we've been putting the webinars. People keep asking, oh, how can I get access to the webinar if they missed it today? Or if you're here but you want to review it, it will be put up onto YouTube. It's on Facebook. It's also always in our monthly newsletter. And also, I just want to mention, we're so grateful. Last month, I think it was Dr. Gluzman gave us the support booklet that you created for colds. Was it called the cold and remedy? I don't want to say it wrong, but we had a great booklet in our newsletter. So we'll keep putting that out there as well. And
and my ebook is on my website. So yeah, so that's all the immune boosters and natural remedies that I use in my life for my patients and my family. So it's like my work of love, and you could find it on my website.
And I just want to say one more thing, how you do something that I think is so special. You do these free consultations over the phone, so you can get to speak to people. And is that right? Like it's a 15-minute.
I mean, I feel like I have my practice, and not everybody needs, really, you need to find a provider that is right for you. So I do offer free consultations over the phone or through video chat to see if we're a right fit for each other, or if I could recommend somebody that is a better fit for the need that you have. So I love these calls. So you could always book that on my website as well.
That's amazing. That's really awesome. Thank you so much. And anyone who wants to send any chiropractors or homeopaths or any naturopaths that you have, just send it over to Dr. Gluzman. You can send it to us. Also, we like to keep a kind of a database so we can refer also to people. And thank you all for coming and joining and being interactive. And thank you for sharing your questions with us today. And Dr. Gluzman, thank you so much for being here and sharing your wisdom and your informative webinar with all of us. And we really, really appreciate it.
Thank you so much. Have a great day, everybody.
Bye, guys. Okay. Bye, Dr. Gluzman.